Hi, my name is Anshuma Kshetrapal. I'm a psychotherapist and a drama and movement therapist. I am also an educator in the field of arts therapies. Basically, I see clients who are individuals and I run groups for psychotherapy and support groups, as well as I teach in various courses in Delhi, Pune, and Bangalore, and I do some workshops in education in the field. And today I'm here on this channel to bust some myths around mental health. So let's go. So, myth number 1. Can I only seek therapy for serious psychological issues? Well, therapy is for everyone. First thing I'll say is that there is mental health support of all sorts. There are support groups, there are therapy groups, there is individual work. There may also be just expressive arts work that you may want to do. So it's really about exploring all options. The second thing I'll say is a lot of clients are always sort of wondering about what they're going to do in therapy unless they have something serious that has gone on with them. The fact of the matter is that if you feel like you want psychological help because you're undergoing any kind of emotional distress, whether from past trauma or any kind of anxiety, then therapy is for you. You can just go there and talk about your issues. It doesn't have to escalate into something serious for you to access therapy. So myth number 2, that counselors, therapists and psychologists are all the same and offer the same services. Now here I think although the terms counselor, psychologist and psychotherapist are used interchangeably in India, often they imply a difference in training, license and expertise. I would say for the specific difference, for example, in between a counselor and a psychotherapist, is that there's the differences in length of time and depth of work. One would say that counseling is a service that is short term and offered for immediate things that are coming up for you, whereas psychotherapy is long term work and offers depth. There are lots of differences which are very technical as well, but we don't have to go into them. For the purposes of a client, it is important to know that counseling is more short term, therapy is more long term, depth oriented work. So myth number 3 here is that I can go to any person practicing any kind of mental health work. Now here I'd say, there's a variety of mental health work being offered in the country, and of course one has to do a self-assessment of what sort of issues are going on, and if a clinical intervention is required, then going to a clinical psychologist. If a short-term issue is bothering you, then a counselor, things like that. But even so, the right fit is very important. Before you go, you would want to sort of assess what sort of training, credentials and qualification is being offered by this therapist. And the other thing is, of course, that even after training, credentials, qualifications, it could end up being that you don't feel heard, or that you're feeling unsafe in any way, or the space they're offering doesn't feel like it's for you. You might feel judged, and if any of that is going on, then I always encourage people to use their intuition. It is a process of finding the right fit, but once found, it can be an incredibly great journey to go on. So yeah, besides training, credential, qualification, one would say looking at your own intuition for the right fit. The next myth is that you have to share everything in therapy and completely be vulnerable. Well, to this one I would say that there is no obligation on the individual to feel that just because you're attending therapy or any other format of mental health work, that you should be made to feel like you have to be vulnerable. I would say instead that if the space feels safe enough, then you can choose to reveal parts of yourself that you would like to work on. The other aspect is that there are many therapies on offer that are completely non-verbal as well. So there are spaces that you can go to which offer arts therapies, in which case then you're not in any obligation to reveal anything direct or talk about anything directly. So then that you're just partaking in art making, and through that process you're working on your trauma and anything difficult that is coming up for you. So since we were talking about creative arts therapies and expressive arts therapies, just to sort of bust some myths around that, what is creative arts psychotherapy or expressive arts psychotherapy? Well, these are all therapies that are being practiced now in India. They're new and emerging, and they're all therapies that are non-verbal because they use the arts. So they use movement expression, some use drama, some use visual art, all as modalities to help the individual or the group express themselves and work very indirectly on whatever's going on in their lives. And it is a way of connecting as well all the social, physical, mental, cognitive aspects of the self. Currently, this is a very up and coming field in the country, and in fact, Artsphere here is offering a course which is a diploma in dance movement therapy specifically that is happening in Pune. It is in collaboration with the Arts Therapists CoLab. To know more about my work and find out a little bit more about creative arts psychotherapy, there are links in the description box below. Also, to connect with us for more such content, like, share and subscribe to this channel. Thank you.